I'm joined by Professor John Newton, who coordinates our work on testing, and by Professor Steve Powis, who's the Medical Director of the NHS. Every day, we're working through our plan to protect life and protect the NHS by slowing the spread and building the capacity so at all times the NHS has got the capacity to give the very best care to everybody who needs it. In today's briefing, after setting out the daily statistics, I want to talk about testing. But beforehand, I'd like to share some really good news. Earlier this week, I said that we are now able to begin the restoration of NHS services. Now that we're past the peak, I can tell you about the next step, the restoration of fertility services. Few families have been untouched by the amazing advances in fertility treatments over the past generation. And I know just how time-sensitive fertility treatment can be and how important it is for the families affected. And I know that this treatment can change lives for the better forever. So when I say thank you to all of you, everybody watching, for staying at home to protect the NHS, of course I'm saying thank you on behalf of the lives that you're saving. But I'm also saying thanks on behalf of the lives that the NHS can now once again help to create. Because together we've protected the NHS and we're now restoring the NHS and restoring the chance for so many couples to start a family. Turning to the figures, 177,454 people have tested positive for coronavirus, an increase of 6,201 since yesterday. 15,111 people are currently in hospital with coronavirus, and 27,510 people have now sadly died across all settings, an increase of 739. As one, we'll remember them and treasure their memories. This is a virus that has a devastating impact on families, on friends, on local communities. And right across government, we're working day and night to defeat it. At the beginning of last month, at this podium, I set a goal that anyone who needs a test should get a test. And that as a nation, we should achieve 100,000 tests per day by the end of the month. I knew that it was an audacious goal, but we needed an audacious goal because testing is so important for getting Britain back on her feet. I can announce that we have met our goal. The number of tests yesterday, on the last day of April, was 122,347. This unprecedented expansion in British testing capability is an incredible achievement, but it is not my achievement. It is a national achievement, achieved by a huge team of people working together. And I'll tell you this, the testing capacity that we've built together will help every single person in this country. Testing is crucial to suppress the virus. I know from personal experience too, just how much people with symptoms want to know if they've got the disease. I know that I did. It helps remove the worry, it helps keep people safe, and it will help us to unlock the lockdown. So many people have tragically died, and the challenge that we still face is vast, but we're making real progress. I want to take a moment to thank and pay tribute to the incredible team who did this together and who joined in one of the greatest national mobilisations that we've seen. We brought together the best civil servants, the best minds from the private sector, the best scientists, the best lab technicians, and the best of the best in the armed forces. Setting stretching, ambitious goals in a crisis has a galvanizing effect on everybody involved. It is a mission. If we hadn't been so bold, if we'd chosen a safer, easier path, I just can't see how we would have built the capacity that we need. In a few short weeks, we've created a new test for the virus in PHE. We've built a network of regional testing centres. We've put a fleet of mobile testing units on the road and created home testing kits. So if you can't get to the test, we can get the test to you. We've more than doubled the capacity of NHS and Public Health England labs and created 3 brand new mega labs to analyse the results. So many people have played a part in this work. British diagnostic companies like Randox and Oxford Nanopore and Medical Wire and DNA Nudge and Samba, logistic companies like the Royal Mail and Yodel, who were brilliant and got us out of a real hole this week, academics like Professor Derek Crook and Sir John Bell from Oxford and Professor Aradazai from Imperial, Deloitte and Boots, who've delivered our drive-through centres, AstraZeneca, GSK, Novacyte, whose labs go on stream next week, Public Health England and the NHS, of course, who've pulled out all the stops, Professor Sharon Peacock, Professor John Newton, and the UK Biocentre and the CRIC, who set up high-tech laboratories. And also, it wasn't just a national effort. People from across the world, including Thermo Fisher, Hologic, Abbott, and Amazon from the US, QIAGEN from Germany, and Roche from Switzerland. And this is how we did it, because everybody worked together with grit and determination to reach a shared goal. And they thrived because the team contained diversity of perspectives, of backgrounds, and critically, a diversity of thought. And when things went wrong, which they did every single day, believe me, we didn't ask who we could blame. We asked how we could fix it. So to my team, I want to say you toiled tirelessly, night and day, and I'm so proud of what you have achieved. As the Prime Minister said, a big increase in testing provides a way to unlock the puzzle of coronavirus. And testing forms the first element of our plan to test, track and trace. By mid-May, we'll have an initial 18,000 contact tracers in place. That work is underway as we speak, and if it needs to be bigger, we'll scale it as required. The combination of contact tracers and new technology through our new COVID-19 NHS app will help tell us where the virus is spreading and help everyone to control new infections. People will be able to know if they've been in close contact with someone who's transmitting the disease and take the action that they need to. Our full-scale test, track and trace model will drive the infection rate down, and the lower the R and the lower number of new infections, the more effective the track and trace system will be. Tracking and tracing will allow us to get R down and hold R down. And so it will allow us to lift lockdown measures. Now, this disease affects us all indiscriminately. We've seen that. In recent weeks, we've had to impinge on historic liberties to protect our NHS and our loved ones. And yet our goal must be freedom. Freedom from the virus, yes, and we will not lift measures until it is safe to do so. But also, we care about the restoration of social freedom and economic freedom too. Each citizen's right to do as they please. For now, we're working together to stay home. We're impinging on the freedom of all for the safety of all. With this next mission of test, track and trace, I'm seeking a solution that allows us, by each of us participating, to target the measures that are needed with much more precision, and so to reassert, as much as is safely possible, the liberty of us all. That is our next mission. But for now, the most important thing for everyone to do, to keep R down and to get us all through this, is to maintain the spirit and the resolve that's had such an impact thus far. So please, stay at home, protect the NHS, and save lives. And now Professor Newton is going to set out some more details on testing, and then I'm going to ask Professor Powys to set out and take us through the slides.
Thank you very much, Secretary of State. And can I also thank you on behalf of the programme for those kind words of thanks. It's been a truly extraordinary collaboration, but thank you very much. We have reached an important milestone, but I want to explain why we need all this testing. Back in March, the country moved into lockdown because the virus was circulating widely, not because we did not have enough tests. Cases were popping up with no obvious connection to other cases, and the infection was entering the exponential growth phase. And at that point, access to limitless testing, even if we had had it, would have made no difference. The decision to enter lockdown would have been the same and would have been taken at the same time. In the same way, the route out of lockdown has not been blocked by low levels of testing. We can relax social distancing only when the government's 5 tests are met, and that means particularly getting the infection rate right down. Testing will, as Secretary of State has mentioned, help to keep it under control once we're out of lockdown. But our levels of testing have not kept us in lockdown a day longer. What about Germany? People talk about Germany a lot, but yes, Germany had a lot of tests available from the get-go. But there was also a lot less virus around in Germany when they introduced social distancing, and it was circulating in younger people. So, as CMO pointed out in an earlier briefing, we should not rush to draw conclusions about relationships between numbers of tests available and outcomes in different countries. Nevertheless, as CMO also said, we are learning from other countries, and we have learned from the experience of other countries. But back to the here and now, where does all this leave us in the UK? Well, the 100,000 tests a day target was set for 2 purposes. As Secretary of State has mentioned, it was intended to motivate the programme and set the scale of our ambition, and it has certainly done that. More importantly, though, perhaps, we knew from our calculations that we would need something like this level of testing to be ready for the next phase of the response to the pandemic. Looking to the future then, we now have a very substantial and flexible testing capability in the UK. It will be used to drive extensive contact tracing to control any new infections, to help us keep patients and staff safe in hospitals and care services, and to tell us with some precision how the virus has spread across the country and is spreading in the future. If we can quickly identify who may have been in contact with someone infected, we can prevent them from passing it on and so drive down transmission rates of the virus. Now, the new NHS app for contact tracing is also in development and making rapid progress. And the more people who sign up for the new app when it goes live, the better informed our responses will be and the more effective we will be in keeping the virus under control. All this progress with testing and with our design of the next phase of contact tracing and the app frees ministers and their scientific advisors to choose whatever future strategies are best suited to keep the country safe. I can assure you that the testing capability we have built in the last few weeks is world-leading in its scale and sophistication and gives us the flexibility we need. As the pandemic evolves, we will have the testing capacity to meet changing demand across the country. It is now there to serve us all. Thank you.
Thanks very much, John. And Professor Powis, if you'll take us through the slides.
Thank you very much, Secretary of State, and good afternoon, everybody. So as I and others have said on many occasions, the magnificent response of the British public to the government's request to comply with social distancing instructions has meant that we have begun to get on top of this virus. We've seen the transmission rate, the reproduction rate fall to below 1, and that means that the number of new infections is falling within our communities. And that has meant that pressure has been kept off the NHS. The NHS has responded magnificently to make sure that patients have always had available the treatment they require. And over time, this also has an impact on the unfortunate number of deaths that we've seen. And as we move to the next phase of managing COVID-19, I think first thing I'd like to do is to remind everybody of the 5 tests that the government has set for adjusting the current lockdown. The first I've already referred to, and that's that the NHS continues to have sufficient capacity to provide the critical care requirements that are needed, but also specialist treatment right across the UK. Secondly, it's that sustained and consistent fall in daily deaths from coronavirus, and we are beginning to see that, but we need to make sure that that is maintained. Thirdly, it's reliable data to show that the rate of infection is decreasing to manageable levels across the board. And again, as I've said, it's everybody's efforts in complying with social distancing that means that infections have fallen and will continue to fall. Fourthly, this has been a challenge, not just in the UK, but globally, around the operational response to a pandemic. That includes PPE, it includes other things. And moving forward, we need to ensure that those challenges, testing is one of them, are in hand and that we are in a good position going forward to meet future demand. And finally, and critically, that any adjustments going forward don't risk a second wave, a second peak of infections that again runs a risk of overwhelming our health systems. So those are the 5 key tests that have been set, and the government will be looking to be confident that it has met those before it moves to the next phase of the lockdown and the measures that we will need to take going forward to stay on top of this virus and ensure infection rates remain low. Now, in the next slide, I'm providing some details of exactly how the British public have complied. And the first is an example on how people have been approaching contact, particularly with vulnerable people, over a period in the middle part of April, showing that 84%, the great majority of adults, have said they'd either not left their home or only left their home for permitted reasons, and 87% of adults avoiding contact with older or vulnerable people. So again, great testament to the efforts that the British public have gone to ensure that we reduce infections. And then on the right of this slide, some information on the number of people who've been working at home since social distancing measures were introduced. And that's 45% of adults in employment saying that they work at home. And that compares to around 12% of last year. So again, a great increase in those that are not going out, that are staying at home and are managing to work without having to go in their usual place of work. And on the third slide, we begin to see the testing information. The Secretary of State said, as both Secretary of State and John have said, the number of tests have increased dramatically. But it's not just the fact the numbers have increased, it's the fact the capacity has increased so that we can use testing for a far wider range of purposes. And you have already heard some of the areas in which that is going to be critical going forward in the months ahead. In the fourth slide, we show the new cases as determined by positive tests. You will see that that has increased a bit in recent days, but that should be seen in the context that we have increased the number of tests in the round. So more testing and more testing of different groups of individuals is likely to bring more positive tests as a result. But overall, I think the number is relatively stable, and that is a good sign and reflects that the level of infection is falling. In the next slide, we then move to people who unfortunately, and again, it's a mild illness for the great majority of people, but for a proportion who do have to be admitted to hospital, you can see that since the middle of April, numbers of people in hospital with COVID-19 have been falling. And that's particularly marked in London, that was ahead in terms of the infection rate, and therefore that fall has come quickest in London. It is starting to move down, maybe at a slower level in other regions of the UK, but nevertheless, overall the trend is downwards. And then that also translates in the next slide to people who, again, small minority but important group that have to be treated in our critical care facilities. This shows the proportion of people with COVID-19 in critical care beds, and again, that is falling in the 4 nations. And the absolute number of people in critical care beds, so not just the percentage, but the absolute number, is also declining. And then finally, we move, unfortunately, to deaths, the sad deaths that have occurred. And again, we're now showing deaths in all settings. We were previously, up until a few days ago, showing deaths in hospital settings. We've now expanded this. And again, you see those numbers do vary from day to day, and there's a reporting lag at the weekend. But overall, the 7-day rolling average, which smooths out those that daily variation, is showing that the number of deaths is beginning to trend downwards. And then very finally, we show the usual international comparison against other countries. And again, this comes with the usual caveat that this sort of comparison is really important. It's now UK all settings, but the real comparison is in all-cause mortality, so in excess deaths in countries. That is measured more consistently between countries, but there will be some time before that analysis can be done. So although it's important to show this data, I think it's important to remember that it will be a number of months and perhaps longer before we can see the true comparison between countries. So finally, to remind people that the hardships we've been going through, the compliance with social distancing is working. The key thing is it needs to continue to work, so we all must continue to not think that this is over. This is really the beginning, but it is translating into benefits in pressure on the NHS and on reduction in deaths. So it's important that we all keep it up. Thank you.
Thanks very much, Steve.